Thank you so much for all the support you gave me, guys.
Okay.
Today, I got promoted.
Those who spread goodness radiate happiness to everyone around them. Introducing LOLC Finance Credit Cards. Fuel the goodness in you.
Welcome to LMDtv. This week on Talking Business, Anushan Selvarajah speaks with the representative for the World Health Organization in Sri Lanka, Dr. Razia Pendse.
Welcome to LMDtv, Razia. Good to have you with us.
Thank you.
Now, could you update us on the COVID-19 pandemic as it currently stands with the new strains that seem to be stretching healthcare across a number of countries?
We are at a critical juncture in the pandemic response for the COVID-19. And while the vaccine brings hope, we have to remember that we need to take all the measures together. Vaccine is not a replacement for the other measures. So we have to stay the course, we have to do it all, and we have to do it better if in 2021 we would want to end the acute phase of the pandemic. And that means that while vaccination is rolled out to the most vulnerable populations in many countries of the world, everyone across the world needs to take the measures, the personal measures in terms of hand hygiene, respiratory etiquette, maintaining physical distance, wearing a mask, avoiding crowds, and ventilation to the extent possible. WHO was reported on this new strain from the UK, South Africa, and then later on other countries have also reported. The research is ongoing and understanding what this variant means. But what we have learned from the UK is that this particular strain, which is N501Y mutant, transmits more easily. And that's why we are seeing increased surges in many countries where this variant is also reported. From the UK, what we have learned is that while it transmits easily, they have not reported increased pathogenicity, that means increased severity of disease. It's important to note that the studies, the research on understanding these variations is ongoing. And WHO has a virus evolution group, that is a group of leading researchers across many countries that monitors these different variations. What is important for all to understand that all viruses, and the SARS-CoV-2 is no different, they undergo changes. And these are monitored over time. And more than 200 variations have been reported of the SARS-CoV-2 to the database maintained by WHO. Up until now, what we have seen is that there is limited impact on these changes on the transmission, on the severity of the disease and mortality due to this virus. So that is good news. However, we need to continue to monitor and research the changes that are being reported. And as we learn more about the virus, WHO will be informing governments and the public on the information on the changes in the virus that is being studied and then later on published. As I mentioned before, while the scientists monitor and research the different changes in the virus, public at large need to take all the measures to prevent the spread from one to the other, and that will help us break the chains of transmission and spread of COVID-19 in 2021.
How is the COVAX initiative progressing?
So the COVAX mechanism is designed to guarantee safe, fair, and equitable access to vaccines as and when they become available. The three main agencies, the WHO, CEPI, and Gavi, that set up the COVAX facility. And then there are other partners that are on board. So it is truly a transforming initiative in the COVID-19 pandemic to ensure that vaccines are available to all the vulnerable populations across the globe. Because this is very critical to end the acute phase of the pandemic and to get back to our lives and livelihoods that have been severely disrupted by the pandemic. So the COVAX facility is kind of a financing instrument that allows procurement of the different candidate vaccines as they get approved by regulatory authorities or are given the emergency use listing by WHO, that these candidate vaccines would be equitably distributed across all countries who are members of the COVAX. So as of now, we are 190 countries who have already signed up to COVAX. And of these 190, 92 are, we call the advanced market commitment countries. These are low and middle income countries who would be given the donor funded doses. And the first priority is to ensure at least 20% population coverage to all the countries as vaccines start to roll out across many countries in the world. And based on the press release that was done on the December 18th by the COVAX facility, that agreements are in place for 2 billion doses to be received by the facility in 2021. And of these, 1.3 billion doses will be distributed to the 92 advanced market commitment countries, which would be donor-funded doses, meaning thereby that these doses the countries will receive at no cost to the country for the vaccine. However, the vaccination programs will have to be set up in countries to roll out the vaccine. As more and more candidate vaccines are approved, that these doses will be picked up by the facility. The aim of the facility is to roll out 2 billion doses by the end of 2021 with the aim of ending the acute phase of the pandemic.
Razia, when could nations such as us expect to receive the vaccine? Because there are a lot of conflicting reports about this.
So there are a couple of things in terms of accessing the vaccine doses through the COVAX facility. One is the availability of the candidate vaccines. That means availability of efficacious and safe vaccine that has passed through a stringent regulatory authority and also has been listed for emergency use by WHO. And as you would have followed, that multiple candidate vaccines have been approved by many countries with stringent regulatory authorities, and WHO issued the emergency use listing for one of the vaccines, that's the Pfizer vaccine. And as these candidate vaccines are approved, these will be picked up by the facility. And what we are expecting is that by the end of first quarter of 2021, the vaccine doses would start to be distributed to the countries who have signed up for COVAX. There is an effort by the facility and by WHO to look into options for an early rollout starting sometime mid to late February, but that would depend on availability of those vaccine doses that are there and readiness of the countries. So for a country like Sri Lanka, what would be important is what the COVAX facility would be looking into is the readiness of the country to roll out the vaccine. Because what the facility is aiming at, that once the vaccine doses are sent to the countries, they should be immediately deployed, that there should be no idle doses lying in the country.
Now, the authorities here have said that they are waiting for WHO approval to get the vaccines, whereas other nations have already started the vaccination process. Could you just shed some light on this?
So in terms of the regulatory pathways, what happens is once a vaccine has been studied, researched, and the trial data are available for the efficacy and safety, these data are submitted to the regulatory authorities in particular countries which would want to use those vaccines. So they are called the national regulatory authorities. For instance, in Sri Lanka, there's the National Medicines Regulatory Authorities. In some of these countries, there are stringent regulatory authorities. Most of these are in high-income countries. So countries that have stringent regulatory authorities, they can, because it's a decision of the country to choose the right tools which is best fit for the population. Now, what is important from the WHO perspective is whatever is being rolled out in the country has to be at the highest standards of science and ethics. Now, there are countries who have national regulatory authorities but still depend on the WHO. Traditionally, it's called the pre-qualification. But in emergencies, what WHO does is an emergency use listing. So after these, at least a few stringent regulatory authorities have approved the vaccine, this dossier is submitted to WHO and there's an independent review, and then an emergency use listing is done. So that's why countries are assured of the safety and efficacy of these vaccines. So many countries depend on this WHO process of emergency use listing or pre-qualifications. So while an emergency use listing is given in case of emergencies, there is the rolling reviews continue to happen till a full pre-qualification is there. So this is just ensures the quality and safety of the product that comes into the country. The other thing that happens once a WHO pre-qualification or emergency use listing has happened, that the process for approval by national regulatories, it can be shortened. Otherwise, it may take a few weeks for the authorities to review the dossier and give the approvals.
Razia, given that countries need about 70 to 80% of their population to be immunized to reach herd immunity, what is your take on the anti-vax lobby or the people who don't want to be vaccinated?
Vaccination saves lives. And we know that there is enough evidence to show that. And the same is true for the COVID-19 vaccine. It is one of the very important tools that we have in 2021 to address the pandemic. Now, most of the anti-vaccination drives are generally driven by mis and disinformation regarding vaccines. So what is most important is for public to get clear, transparent, and credible information on the vaccines, what the vaccine can do, what it cannot do, why is it important to take the vaccine, and because that informed choice, when it is given to public, I think there is enough rationale in terms of the people at large that they will be then opting for that prevention measure. And as I have mentioned, and we all know, that this has been a very, very unprecedented and disrupting pandemic that has impacted lives and livelihoods across the globe. And as vaccinations start to roll out across different countries in the world, it's important to get that information and communicate clearly to the public. And to say that whatever vaccines that are deployed by the governments for their citizens, they are safe and effective. In the age of social media, there's a lot of the infodemic that goes around, and it's important to do the scanning of the misinformation and the disinformation that is going around, and to bust the myths and misconceptions. And there's a very important and critical role of media to also look into this, the mis and disinformation that's going around, and guide people to get the right information.
We're going for a short break now.
Our story is one of reimagining. Reimagining who you can be, what you can achieve, and how SEMA can support you. As technology and digital platforms disrupt businesses, we are reimagining what the profession can be. We've updated our syllabus to meet the expectation of employers, ensuring SEMA-qualified professionals have the skills to make an impact from day one. Reimagine your career. Contact SEMA Sri Lanka.
Welcome back to the show as we continue our discussion with the resident representative of the World Health Organization in Sri Lanka, Dr. Razia Pendse. Razia, what about the children? Now, we've heard that there needs to be more research or trials run before they are even brought into the picture. Now, vaccines are not even going to be given to those under the ages of 18. What does this mean in terms of us reaching herd immunity if we don't think about the children?
So, what we have seen with the COVID-19 is that children generally we have seen that in children there is less severity and less mortality due to COVID-19. What we have seen, it is the elderly, those people with comorbidities that are highly vulnerable, and most of the severe disease and deaths have happened in those populations. The candidate vaccines that have been trialed and for which the data is available, most of these candidates have been tested in populations 18 and older. And we have one vaccine that has been tested for 16 and older. There is research ongoing on population groups younger than 16. There are some vaccines being tested up to 12 years, and perhaps more research would be done in lower age groups. Because these vaccines have not been cleared for use in less than 18 or less than 16, depending on the candidate vaccine, children are not part of the COVID-19 vaccination plan as of now. And one of the reasons, as I said, is that we have not seen that much intensity of transmission, death, and disease in children. So while we need to protect our children for the rollout of the vaccine, it's important to protect the most vulnerable. And for the COVID-19, and I hope it continues to stay that way, children are not the most vulnerable. They have been impacted by the pandemic in different ways, especially being out of school, socially isolated. So there are other issues that children have faced during the pandemic, but the direct impact of disease has been less in children.
How do you view the reports that rich nations are ordering and stockpiling more than what they need in terms of the vaccines? Granted, it could be a case of them stockpiling just in order to help poorer nations or friendly nations. But how do you view this?
So, as I said, vaccine is good news. Availability of a safe and effective vaccine really empowers our response to the pandemic hugely. But what is most important is that all vulnerable people across the globe should get access to the vaccine. Because virus doesn't respect boundaries, and we have seen that for the COVID-19. And virus anywhere is a threat everywhere, especially in a globalized, interconnected world. And no one is safe until anyone is safe. And the deal that we have made in the pandemic response is that we will ensure access to all vulnerable people in all countries. In other words, that some people in all countries need to get access to this important tool for the pandemic response. If all people in some countries get the vaccine, we will not be able to turn the tide on the pandemic. It's important that global solidarity and equitable access is what is going to help us end the pandemic. Vaccine nationalism is not going to save lives or livelihoods. Global solidarity will.
Razia, there are reports that airlines and even some nations are expecting people to provide proof of immunization going forward. Now, would this be par for the course?
So what the requirements in terms of the airline travel or individual country in terms of border control would be, I think so it's beyond my scope to answer. But what in terms of the pandemic response and the international health regulations, what I can say is that it's important to distinguish between, what we get is a certificate of vaccination, like a vaccination card that you have received a set of these vaccines, and a requirement of vaccination for travel. What WHO is currently looking at is how to have a common vaccination record, which would also document the vaccination for COVID-19. It's also important to make a distinction because there was a lot of discussion on immunity passports, something which WHO does not recommend. Further, we also need to secure enough supply of vaccines for people to get that vaccine. So demanding something for which supply is not there, it's a balance that has to be struck. And that's why I said that until everyone has access to the vaccine, any kind of global mechanism would need to be discussed in detail and what repercussions it would have. Till date, the only record for vaccination that is required for travel and which has been approved by the International Health Regulation is for people traveling from yellow fever endemic countries. And if you have traveled, you would know that there is that typical yellow-colored vaccination card for yellow fever. That is a requirement for travel. For the COVID-19 vaccine, would that be needed? That is something that has to be discussed by the Committee of the International Health Regulations, and discussions will need to have, with all the member states.
So as a final question then, Razia, we're looking at 2021 to be the year of the vaccine in the hopes that the world will be more like 2019 as opposed to 2020. Would you agree with this?
You see, 2021 has ushered in with a new hope that we have vaccines that are getting approved. Vaccination has been rolled out. And that's, as I said, is a very important tool and not the only tool. It's important to say that it is one of the tools that we have. And moving forward, if we have to look at 2021 to be better than what 2020 was, we have to stay the course. We have to do it all. We have to do it better. So while vaccinations get rolled out, all of us have to take the measures that we can within our, individual capacities. And that way we will be able to break the chains of transmission, the virus moving from one person to other, because virus loves people. It needs people to transmit from one to the other. And if we propose barriers for the virus to move from one to the other, that is a very, very potential weapon that we have in breaking the chains of transmission. Vaccination will accelerate the process of breaking those chains of transmission and halting the spread. And hopefully we would be in a situation where we will be able to travel, to meet, children would be able to go to schools, the economies would be able to run. So there is a renewed hope in 2021, but let's not forget that we are still amidst a pandemic. Many countries are seeing renewed surges. And what we have learned is that any situation which leads to people getting together or crowding leads to a cluster that's formed and the transmission becoming more intense. So if we can continue to be on course, on track, and do all that it takes for the virus, to prevent the virus from moving from one person to the other, we should be ending 2021 on a high note.
Well, let's hope everything works out for the best and we get back to some sort of normalcy sooner rather than later if everyone works together. Thank you very much for joining us on the show, Razia. It was a great pleasure talking to you.
Thank you very much.
After a short break, Ashwini Vethakan will bring you an update on life on Earth. Stay tuned.
Welcome back to the show. I'm Ashwini Vethakan. Smarter technology is driving empathy, human connection and societal engagement, helping people to understand those from diverse communities while increasing learning, innovation, connection and advocacy, according to the Lenovo Group. A majority, 60% of those surveyed in the company's New Realities, Empathy and Technology report revealed that they have become more empathetic during the COVID-19 pandemic than previously. This optimism with regards to technology bridging the empathy gap is observed particularly among younger generations, as it has been credited with facilitating communication to bring people closer together in times of isolation. Despite these advances, there have also been challenges in enabling global populations to be more empathetic. While the idea that technology is capable of benefiting society through advancements is not new, it has also been observed that these advancements can cause apathy, dislocation, and anxiety. Moreover, the survey reveals that people are concerned about the spread of misinformation, online bullying, information overload, and tech fatigue. More than 3/4 of global respondents see an empathy gap and believe that society should be more empathetic. However, opinion is split on whether the scenario is changing for the better, with 40% believing that society is becoming more empathetic and 39% saying it's becoming less empathetic. These opinions vary across global markets. Among the top 5 countries that reported an increase in feelings of empathy are China and Mexico with 7 in 10 respondents, followed by India with 68%, the US with 67%, and Brazil with 63%. According to the survey, 66% of respondents say technology has made them feel more empathetic towards their communities during the COVID-19 pandemic. Furthermore, 62% of those consulted believe that it has made them feel more empathetic towards their countries during the pandemic, while 59% are of the view that it has increased feelings of empathy towards the world during this pandemic. On the other hand, 53% of those surveyed indicate that they want to disconnect from technology more than before the outbreak of the pandemic. This may be due to greater reliance on technology and decreased connection to nature during this time. Meanwhile, a majority of 73% of global respondents believe technological advancements have positively impacted young people's ability to engage with global issues, while 57% view technology as the cause for an increase in anxiety. Technology has also been credited with facilitating education, as 68% of those who were consulted say it caused an increase in learning. Additionally, the vast majority, 89% of those surveyed, believe the role of tech companies must change to use profits and innovation in addressing major issues around the globe. That's all we have for you this week. Don't forget to subscribe to our YouTube channel and follow us on Facebook and Twitter. Thank you for watching and stay safe.